The third component is placement, where assessment results are used to decide a child's appropriate education placement within a continuum from the least to the most restrictive settings. During the evaluation, student performance is assessed and the team determines if there would be any changes in the educational placement within the continuum. This means teams will base this on their observations, assessment results, and other factors with the goal to toward the least restrictive learning environment. Sound decisions are made to allow for fluidity in the child's placement based on the child's strengths, abilities, and needs. A general education classroom is the least restrictive environment for a child with additional needs. Access to the same learning experiences and opportunities is provided as to typically developing students. Thus, it is considered as the most normalized typical setting, Gargoyle 2012, and additional support in the form of accommodations or changes in expectations through curriculum modifications may be provided but still within the same classroom as peers within the year level. So, there are another option for placement. It is to be in a general education class but the child receives supplementary instruction and services such as speech, physical, and occupational therapy or counseling services. During the school day, options may be provided when such sessions are conducted, either during school or as an after-school service. In such placement, it is assumed that the child will benefit more from either a small group or individualized instruction, with a specialist teacher who will be able to more intensively target his learning needs. Other students need more intensive support that is not provided in general education class. Teams may decide to recommend placement for a child in a more restrictive setting, such as a self-contained special education class but still located in a general education school. Moving up in the placement continuum. Some students who need more intensive instruction and supports are educated in a special education class in a special education school. Teams of professionals, along with a special education teacher, work with students with disabilities and additional needs in a highly specialized setting. On the other, er, on the other end of the continuum is the most restrictive or isolated setting, such as a residential facility where students live and receive their educational support 24 hours a day. Finally, children with multiple disabilities, often of the severe kind, are provided with home or hospital-based programs to manage their medical condition and learn as much as they could. There are 8 educational placement options. First is home or hospital program. Second is residential facility. Third is special education class in a special education. Fourth is self-contained special education class in a general education. Fifth is general education class with resource center instruction. Sixth is general education class, inclusion or co-taught with a special education teacher. Seventh is general education class with related services. And lastly, general education class with modifications. So these are the educational support or the continuum educational placement. So that's all for the third component, which is placement.